But great to see everyone here. This is just an extension of Employee Appreciation Week into Employee Appreciation Month. So welcome to this staff meeting where it's going to be more about fun than it is about meeting, but we are going to follow all the rules we absolutely need to make sure that we're doing this right. I wanted to start by saying, I've been here now 16 months. It's been fantastic, and I've been spending a lot of time thinking about our department, how we can work differently together, and one of the things that I wanted to do right away was to make sure you knew how much you were appreciated, and how much I appreciate you personally, but really that appreciation spreads across whether it's the governor or frankly the people of North Carolina. And so we did a lot of focus on doing things like Joy at Work events, and frankly all of those events were done on literally no budget, literally zero. And Erica Ferguson, who's my special assistant, and her creative work, and Amanda Parks and other folks on our team were super creative on literally zero budget. But I'm really excited because you see we're going to have pizza today, which means we have a tiny, tiny budget now, which makes me so happy because you deserve more than just pizza. But this is what we can do, and want to make sure we can show our appreciation at every turn here. But thank you to the creativity of everyone who's planned Joy at Work events on literally zero budget, not just here on the Dix campus, but across the state. Now with a little bit of a budget, we're hoping to even further these kinds of activities because it's really important for us to take a moment out of our days to enjoy each other's company, say hi to folks you've never met before in the department, and remember that to have a little bit of joy at work. So instead of giving a long speech, I thought I would do something different today. We'll see how it goes, and it involves these chocolate candy bars. I thought about apples, but then I didn't think that everyone would be as excited about apples, so yes, it's chocolate. Everything in moderation, hashtag everything in moderation. So what we're going to do is talk about what I mention at every staff meeting, and it's our values in the department, and so they were on posters and things like that. So we're going to do this as a little bit of a game of Jeopardy. So the first two questions are really easy as warm-up, and if you answer the question right, you get a bar of chocolate. And so we don't have a total free-for-all. We're going to try to do like a first to raise your hand. Kristen is going to call on you. If you get it right, Amanda's going to bring you some chocolate. If you get it wrong, Kristen will call on the next person she sees, and we'll go from there. All right, starting off very easy. So the first question is, can you name all 6 DHHS values? Who can name all 6? All right. That was supposed to be easy. All right, can you name 3 of the 6 values? Who can name 3 of the 6 values? Come on. Come on, there's chocolate involved. Who can name 3 of the 6? Oh, guys. Oh, you're hurting my heart here. Oh, yes. Okay. All right. Oh, wait. Okay, I didn't mean to make the pregnant lady travel around with the microphone. We didn't hear you. Joy, collaboration, and transparency. All right, yay! All right. Okay, those are 3. Who can name? All right, I'll make up the other 3. So first, it's a focus on those we serve. It's being people-focused, right? Making sure that we know every day, at the end of the day, who we are serving here, because there's a lot of bosses in the world, there are. But making sure that we ground ourselves on who we are focused on. So the other one, so was mentioned, was teamwork. The next is proactive communication, right? And communication involves as much talking as it does listening. Then transparency, stewardship, and then joy. Everyone can remember the joy one. I saw everyone being like, joy, what else? Okay, so the next part of this is that I'm going to go through a couple examples of some really great work under each of those values, and you tell me so it's like Jeopardy, sort of. So I'll give you the answer to the question, and you tell me who that is. So we'll start with this one that's under people focused. So, this training had a 97% completion rate across the department that highlighted our commitment. Oh, okay, raise your hand. Raise your hand. Sorry, I'm not calling. Yes, unlawful workplace harassment prevention training, but I'll give it to you. My Alex Trebek is not as good. He wouldn't have let that happen. Right, but truly, thank you. 97%. That is unbelievable. We ranked highest in terms of the large agencies. We by far swamped everyone else. And I just think it shows the commitment that everyone has to making sure that we have a safe and supportive environment, because we need to have that here to reflect that and to be people focused in the work that we're doing. Okay, next, you ready? Other people focused. After 1 year of this funding, the cross-divisional opioid team with partners across the state was able to serve an additional 5,700 people for opioid use disorder. What is that funding source? We've talked about it at staff. All of these things we've talked about at staff meeting. What is that funding source that was able to get more than 5,000 people new access to? Okay. Woohoo! The Cures Act. Chocolate. Okay, this is, are you reading our newsletter? Are you reading our news? This is definitely in our newsletter. Thank you, Amy, and the comms team. This team at the J. Iverson Riddle Center makes adaptive, specialized equipment for residents, many of whom have a wide range of cognitive and physical disabilities, tweaked to meet their individual needs. The team of 6 fulfills about 2,000 work orders for nearly 300 residents. Who is that team? Close? Do we have, okay, a second guess? I'm going to go, it was close. Okay, it was the adaptive engineering team. So they're a fantastic team at the Riddle Center that's made to order for nearly 300 residents, all of these different things. All right, chocolate for you, woohoo, yay, okay. Okay, so next under teamwork. DHHS submitted this report to the General Assembly, providing an informed vision for the future of North Carolina's behavioral health system. This is an easy one. What report did we provide to the General Assembly that offered solutions to challenges facing our behavioral health system to align with our transformation with the state's Medicaid program, our improvement in state-operated facilities? It was a cross-divisional effort between DMA, DMH, DSOF, Government Affairs, Communications, and more. What report was this? Yes, winner, chocolate. Thank you to the team doing the Behavioral Health Strategic Plan. Okay. Also on teamwork, this annual drive in its 25th year broke new department records with collecting more than, okay.
I want to say, what is the Easter Bunny Drive?
That's right, the 25th annual Bunny Drive. That's right. So that Bunny Drive gave over 2,800 stuffed animals donated by our employees to VA hospitals, pediatric centers, and nursing homes. Yes, exciting. Okay, then, all right, another team. This team has released more than 14 policy papers in the last 6 months describing the different parts of the Medicaid program as we transition to managed care. Excellent, the Medicaid transformation team. Very good, chocolate, winner. Okay, under proactive communication. All right, so we did people focus, we did teamwork, proactive communication. This team proactively reached out to business leaders and partners across the state to help find employment for North Carolinians with disabilities. This program works to address the 45-point unemployment gap between working-age people with disabilities and those without. I just gave a speech on it this morning. What program am I talking about? Project Search is a good guess, but no, but that is also an excellent program that I hope we learn more about, where we employ folks with disabilities here at the department. It's under a bigger umbrella.
Yes, sir, in the back.
Up, close. There's a particular program focus that we target to business leaders across the state. Oh, good. So she said Project Search is one piece of this program. Okay, we're trying again. Nope. Everybody Works. Yes, winner. So again, the Everybody Works program is a program, again, that's sponsored by our Council on Developmental Disabilities and Voc Rehab to address and help folks find employment for those with disabilities. All right, another report. Are you reading our newsletter? Are you following me on Twitter? Okay. The Minority Health and Disparities Division or Office released this report, which highlights areas of progress as well as highlights areas for needed improvement for a healthier North Carolina. What report did they release? The Office of Minority Health and Health Disparities. Kind of gives it away, the name of the report. Close. I'll give it to you. It's the Health Equity Report. So every year we do this report that helps break down data by race and ethnicity. It's really important that we are understanding where all of our progress is, but also the places where we need improvement, and we have some areas of focus that you're going to hear about more. All right, so that was proactive communication. On transparency, I still have chocolate left here. Okay. This is a hard one, I think. This state center released an interactive map with a series of overlays showing social determinants of health indicators across the state. It is on our homepage right now at DHHS. Who is the state center that created this interactive map showing social determinants of health indicators? It's not Rural Health. Yes, sir. Yes, the State Center for Health Statistics, which is in our Division of Public Health. So I hope you all go to our homepage. It is what is highlighted right now on our homepage. It's this incredible map that you're able to drill down to the census tract level to see different sorts of social determinants of health, meaning how much do folks spend on their income on housing? Do they have access to a vehicle? Is it a food desert? Really interesting statistics that can help drive our decision making here. Okay, so let's move to stewardship. Okay, this team, truly on a shoestring budget, designed a new workspace for the Medicaid and ITD staff and their consultants in the McBride building. Who is this team? Who are good stewards of resources, helping us get a workspace for team collaboration. I don't know, team. That is correct. Our facilities team, led by Luke Hoff, and thank you, facilities guys. Great work. Okay. So, all right, last one, and then we'll eat pizza, I promise. Okay, the last one about joy at work. This division is helping to reopen the Dick's Grill as a training site and under a new name. Yeah, that's a big one. Division of the Blind, big winner. All right. I'm going to ask again, now that we've reviewed, who can name for me all 6 values of the department? Who can name all 6 values? Come on, you could do it. Here you go. She's raising her hand right here. Yep, team. Stewardship, yes. Okay, very good. Remember our 6 values. We're people-focused, we're team-oriented, that we have proactive communication, transparent, good stewards of resources, and joy at work. Okay. Decent job, decent job. Keep reading our newsletter for that proactive communication. Visit the website, look for that map. And thank you to all the teams that are really doing great work. This was just meant to highlight just a touch of some of the things that are going on around the department that I'm so, so proud of. So with that, I'm going to thank Amanda and Catherine and Erica, our facilities guys, for all the work that they did to make sure that we had lunch today. So enjoy pizza, enjoy cake, enjoy spending time with each other. Thank you, thank you, thank you for all you do.